Thank you everyone for attending our presentation today. I'll start by taking this opportunity to acknowledge the traditional owners of the lands on which we live and work. Today I am working on the lands of the Bunurong people of the Kulin Nation, and I pay my respect to elders past, present and emerging, and to any First Nations people who have joined us this morning. And I acknowledge that sovereignty was never ceded, and this always was and always will be Aboriginal land. Thank you again for attending this morning. Our session is on recognising and responding to elder abuse. And I'm going to spend the first part, I should introduce myself. I'm Avital. I am the Manager and Principal Lawyer at Seniors Rights Victoria. I'm going to spend the first part of the session briefly going through the types and indicators of elder abuse. And also for those of you who aren't familiar with us, I'm going to talk a little bit about the work that Seniors Rights Victoria does and how you can refer patients and clients into our service. I'm also joined today by our advocacy team leader, Jacinta, and Leonie, who's one of our community lawyers, and they are going to take us through a detailed case study to give you an idea of the kinds of matters that we deal with on a day-to-day basis and the complexities that arise in our casework. As well as that, our media and comms manager, Steve, will be driving our slideshow and monitoring the chat and the Q&A functions. And we have set aside some time towards the end of the presentation for questions. So please do make use of those functions throughout the presentation. All right, so a bit about Seniors Rights Victoria to start. SRV is a free and confidential service for people over the age of 60 and for Indigenous Australians over the age of 45. We are a community legal centre that operates under a multidisciplinary model where lawyers work together with advocates to provide advice and, in more complex cases, holistic case management to older people who are experiencing or are at risk of experiencing elder abuse. We specialise in legal matters like family violence and personal safety intervention orders, guardianship and administration, things like family agreements, so including granny flat arrangements, misuse of powers of attorney, financial abuse, property disputes and debts. And we also support clients to access housing services, home care packages and counselling. We're the only statewide specialist service that provides ongoing casework and representation for older people in VCAT guardianship and admin matters. So we are at capacity a lot of the time because there is a significant demand for the service. In addition to the casework services that we provide, we run a statewide helpline where older people and concerned friends and family can get free and confidential advice and information without any pressure to take action. The helpline is also available to professionals who are seeking secondary consults, and in those cases we can provide information, assistance and support for workers to either work directly with the client or assist in referral of the client into the SRV proper. We also run elder abuse prevention and education programs across Victoria, and we've produced resources to raise awareness and provide information about elder abuse, and I'll give a little more information about how to access those later in the presentation. For the purposes of the work that we do at SRV, when we're talking about elder abuse, we're talking about abuse occurring in the context of a relationship of trust. So not in relationships where there is a consumer relationship or professional relationship, or where things like harassment or criminal acts are perpetrated by a person who is unknown to the older person. So usually the relationships of trust that we are working in are ones with other family members. And in most instances, the family members are the adult children of the older person who's experiencing the abuse. An older person might become a victim of abuse. Any older person might become a victim of abuse. There are no direct correlations between demographics and older people who might be experiencing elder abuse. However, there are certain demographics who face additional barriers to accessing justice when they are experiencing abuse, and those include culturally and linguistically diverse communities, Aboriginal and Torres Strait Islander communities, LGBTQI plus communities, and people living in regional and remote areas. The National Elder Abuse Study, which was conducted by the Australian Institute of Family Studies and published in 2021, surveyed 7,000 people over the age of 65 who were living in the community. So it didn't survey people living in residential aged care, and it required engagement by the community members directly. So this is the most comprehensive study that we have about the prevalence of elder abuse in Australia. From the study, it was found that 1 in 6 people over the age of 65 had experienced some form of elder abuse in the previous 12 months. And just on the table there, you can see the different types of elder abuse and just a few examples of how they might present. Unlike family violence generally, which largely presents as intimate partner violence with women overwhelmingly as victim survivors and men as perpetrators, elder abuse is very different. The data in the prevalence study shows that adult children of older people were the largest perpetrator group, and that both men and women perpetrate elder abuse in much closer proportions than family violence generally, with different types of abuse more likely to be perpetrated by men than women and vice versa. As well as the different presentations of abuse, they can occur on a spectrum of subtle through to extreme. So media representations of elder abuse are always extreme. So there is a lot of hesitation to report abuse when it is occurring on a more subtle scale. And there's almost an implication that if abuse is occurring in a more subtle way, that it doesn't qualify as abuse. And at SRV, we do see a small percentage of cases where elder abuse is extreme, but for the most part, it does seem to present as a slow boil, starting off in an extremely subtle way, and often with the older person's interests in mind. That just seems to get out of control. In agencies like Seniors Rights Victoria, financial abuse is the most prevalent type of abuse experienced by clients. And the reason for that is, we suspect, because it takes a tangible form of abuse before someone is willing to pick up the phone and make a report or seek assistance. People are more reluctant to report instances of things like psychological abuse or neglect, and also because of elements like social isolation. And language barriers, technology barriers, that also has an impact on the reporting of elder abuse. So some things to look out for in your practice that might be signs that an older person is experiencing abuse or at risk of experiencing abuse. Things like sudden or unexplained changes to their emotional state, heightened fear or anxiety, and changes to their financial affairs as well. So if they're suddenly unable to pay their bills or they don't have control of their finances. Changes to how they present at appointments also are noticeable, or if there is a third party in attendance with them who won't leave them alone for the appointment, even after requested to do so. Things like family or non-family members seeking decision-making capacity assessments, and if they're persistent with seeking these assessments, that can sometimes be an indicator of abuse as well. And requirements for powers of attorney, changes of documents, and those sort of more logistical things that confer control to a different person from the older person. So all of those might be signs that an older person is being abused or is at risk of abuse, but of course they could be signs that something else entirely different is occurring. So if you do suspect abuse, it's important to have a discussion with the older person to gather information slowly, and ask open-ended and kind of innocuous questions to begin with, because often in a relationship of trust, there's great reluctance to openly disclose abuse or fear of the perpetrator. So when inquiries are made of us and there's no clear disclosure, we can ask things like, how have things been since your daughter started visiting more frequently, and what's it been like since your son moved back home? Those sort of questions that might lead into a bit more of a disclosure and a little bit more of an open conversation, just so you can get an idea of whether there is or isn't abuse occurring, or whether there is a risk of abuse occurring. And I think it's also important that when you are gathering this information, or even if a direct disclosure is made, it's important to acknowledge that the older person may not want to take any action. They may just want to discuss the matter, and they may just want to debrief about it to someone, but without being offered solutions or receiving any sort of pressure to take action. And the reason for that is a lot of the time because of those complex family dynamics that present in those situations. So this is our service eligibility criteria. So we will accept referrals from services working with older people, from health services, from aged care services. As long as these eligibility criteria are met, we will be able to assist with legal advice and possibly ongoing casework, depending on the needs of the client and the capacity of our service as well. So they do need to be over the age of 60, or if they're Indigenous, over the age of 45, as I mentioned earlier. They do need to be experiencing or at risk of experiencing elder abuse in the context of family violence. So as I mentioned before, if they're experiencing abuse by a paid carer or in the context of a professional relationship, they will not meet our eligibility criteria. They have to be residing in Victoria, and probably the most important one is they have to have capacity to give instructions. So whilst we would like to assist everyone, because we are fundamentally a community legal service, our clients have to be able to provide us with instructions, and we have to be confident that they are understanding the advice that is being provided to them as well. So our standard for capacity is different from a full capacity assessment, but we have to be able to assess that they are able to understand advice that's given to them and provide us with instructions as well. So those are just a few things to keep in mind if you are going to make a referral into Seniors Rights Victoria. Okay. So I'm not going to take questions yet. I think we will we'll leave a time for questions at the end. So if anyone has questions in relation to our service delivery or anything that I've mentioned about Seniors Rights Victoria, we'll take those questions at the end. But before we do that, I will reintroduce Leonie and Jacinta to take us through a case study. Okay.
Hi, so I'm Jacinta. As Avital said, I'm the advocacy team leader at Seniors Rights Victoria. We've got a case study here that we're going to present today of Minh, and Minh is she's as you can see here, a 79-year-old Vietnamese woman who's been caring for her husband Don, who's been diagnosed with advanced dementia. She was referred to Seniors Rights Victoria by a social worker at Monash Health after her stepdaughter Alison has applied to VCAT to take over Don's affairs, and Alison has threatened Minh with removal from the family home. Minh has had no services to advocate for her. She's a very independent person, and over the last couple of years, she's been hospitalised for a heart condition, and more recently for some kidney issues. And then she's had the general, we've had COVID, we've had a flu, those type of things along the way. But apart from those two things, generally in good health. Ming and Don don't have a computer and there's no internet at home, and English is their second language. Don has a home care package. So Ming and Don have been married for 30 years and Don has 2 children. He is generally in good health. However, as I said, he has advanced dementia, and Ming has been acting as his carer for 15 years. Alison, during that time, so Ming has been Alison's stepmother for the majority of her life, of Alison's life, but now she's started to emotionally, psychologically, and verbally abuse Ming, making accusations of Ming abusing Don, such as not feeding him, verbally abusing him, and faking her own health episodes to basically justify what Alison sees as her poor behaviour towards Don. When Alison visits the family home, Ming has to stay in her room due to the fear of abuse. And in fact, if Ming is not in her room, she does experience abuse and, finger pointing, and basically backs Ming into a corner. So Alison has told Ming that she will move herself and her family into the home, and Ming would have to find somewhere else to live because it's not her house. Alison sees it as being Don's house, and this elder abuse has been ongoing for some time, and it's generally been ongoing since Don has lost, as it's escalating as Don is losing capacity. But it has been going on since since his dementia has been diagnosed. So initially, Ming was referred to an elder abuse outreach service, as well as Seniors' Rights Victoria, and referred to Seniors' Rights Victoria for legal assistance. But given the conflict between Ming and Alison, that service made the assessment that Don was actually the most vulnerable person, and that was the person they needed to support. And so they went ahead and moved that service from Ming to Don. So it was at that point that the Seniors' Rights Victoria lawyer, they continued to work with Ming, but an SRV advocate came on board to work with the lawyer. And at around that time, that elder abuse program that was supporting Don was defunded. So that was the integrated model of care, who some of you may know, and that was defunded about 14 months ago. So they had to withdraw all their services anyway. So the family was left without advocacy, which is why I stepped in then. And I'll hand over to Leonie.
Hi, I'm Leonie. I am a lawyer at Seniors' Rights Victoria. So as I see it, Alison was trying to force her father into aged care and was wanting Ming out of the property so that Alison could sell the family home. As part of her abusive behaviour, Alison made an application to VCAT to be appointed as Don's guardian and administrator. In this application, Alison falsely claimed that Ming was abusing Don. Alison also applied for a family violence intervention order to protect Don from Ming based off the same fabricated allegations of family violence. Ming initially saw a private lawyer and arranged for a caveat to be placed over the family home to prevent Alison from being able to sell the property. However, Ming could not afford to retain a private lawyer to represent her on an ongoing basis. Ming was not in attendance at the initial VCAT hearing. Although Ming had received the VCAT notice of hearing, she could not read it because it was in English. In that hearing, VCAT made an order appointing Alison as Don's guardian. Ming was also only made aware of the family violence intervention order after the final order was made and served on her by the police.
So throughout the time that the SRV advocate has worked with Ming, the system has worked against Ming, and certainly prior to that as well. Alison can present as very charming and sweet, which often works against Ming and supports this system's abuse. And whether it be police being called by Ming when Alison has come to the house and is being abusive, and the police not engaging an interpreter or using Alison as the interpreter, to the Magistrates Court and VCAT using interpreters to deliver only main points of hearings rather than including Ming the whole time. This is systems abuse. It also continued when we tried to apply for a carer's allowance recently, where Centrelink provided barriers by providing messages only in English. And then when Ming couldn't provide her CRN number because she didn't know what they were asking, it says hold the line and then hangs up on her. I then took Ming and Don down to the Centrelink office and waited for 45 minutes. And when we were called up to the desk, we were told that we'd have to book an appointment and she'd have to wait another 2 weeks to have a phone appointment where they could supply an interpreter. So on both the VCAT application and the application for the Family Violence Intervention Order, Alison had purposely excluded Ming from the matter by putting Alison's own contact details for Ming. So Ming had no idea there had been a hearing, and no one, when they were sending those documents out after the hearing, no one noticed that the respondent and the applicant's details were identical. So Ming was never notified either of the hearing or of the outcome of those hearings. Throughout the course of this matter, Alison has frequently told Ming that no one will believe her because she doesn't speak English. And in addition to the language barrier, Ming is also the primary carer for Don, making it hard to appear at VCAT and the Magistrates Court. So to counteract this, the SRV lawyer and advocate attend hearings from Ming's home so she can stay with Don and attend to his needs if necessary. Due to both systemic challenges and the abuse by Alison, Ming can become quite emotional and requires continuity of workers who are able to support her, understand these challenges and the impact they are having on her mental health. And SRV are able to do that using that integrated model. Leonie?
Yes, that is where the integrated model does really make a difference in being able to holistically support our clients. We were able to help Ming overcome these barriers of justice through facilitating her participation in hearings and engagement with the legal process, essentially ensuring she had a voice. Seniors Rights Victoria successfully convinced the Magistrates Court that Alison's complaint against Ming was primarily to do with her father, Don, and the most appropriate forum for this complaint is VCAT. The VCAT matter is complex and there's been multiple hearings to date. One of the challenges in this particular matter has been there are different people appointed as substitute decision makers for different types of matters, different types of decisions. There's essentially 3 different types of decisions. You have medical, personal, and financial decisions. Originally, VCAT made an order appointing Alison as guardian, which meant that she had the ability to make personal decisions on behalf of Don. It was later discovered that there were 2 enduring powers of attorney. The first one appointed Ming as the substitute decision maker for financial and personal matters. And then there was a later one that appointed Alison as the financial and personal decision maker. So there was also a medical treatment decision maker appointing Ming, and there's no disputing that the validity of that document. So you've got a situation where there's multiple enduring powers of attorney. There's been an order appointing a guardian. In a subsequent hearing, the VCAT set aside the order appointing Alison as guardian because of and affirms the validity of the enduring power of attorney appointing Alison. Seniors' Rights Victoria then successfully argued that the enduring power of attorney appointing Alison should be set aside on the grounds of undue influence and lack of capacity. At the time of signing this document, Don had limited decision-making capacity. Moreover, the document was prepared by Alison and wasn't read out to Don in Vietnamese, Don being unable to read English. The enduring power of attorney appointing Ming was read out to Don in Vietnamese. However, VCAT ultimately determined to set aside this power of attorney also due to the long-standing family conflict between Ming and Alison. Ultimately, VCAT referred the matter to the Office of Public Advocate to investigate whether an independent administrator and guardian should be appointed. So, would anyone like to hazard a guess as to who was listed as Don's next of kin when Ming was recently admitted to hospital? No? So the answer to that question was Alison. Alison, in a previous admission to hospital, Alison had provided the enduring power of attorney. The hospital hadn't checked whether that enduring power of attorney was still current when Ming was admitted most recently. So on their records, they had Alison down as the next of kin for Don, when in reality it would have there was no one that was appointed to be able to make personal decisions on behalf of Don. So because the matter had been referred to the Office of Public Advocate for an investigation. All right, Jacinta, over to you.
Thanks, Leonie. So as I discussed earlier, Don has a home care package, and it's been proven to be a bit of a minefield, as Leonie was discussing, when it comes to the services in home and for respite. So who do you defer to when Don needs to go into respite, and who has the authority to authorise payments, to authorise the decision to send him to respite? And so, yeah, this is part of this minefield that we're trying to tease out with VCAT and the Magistrates Court and the respective parties. So the advocate has discussed with Ming on many occasions the need to engage with services such as her own home care package. And, you know, that is something that as a social worker, we give you all the information, we discuss with you the pros and cons, but it is up to the client themselves to make that decision. And I will continually support Ming. However, she doesn't want to be a burden. She feels that she's being a burden by engaging in a home care package and other services, given that she already has SRV. And she feels that she can do things on her own around the house and to be able to look after Don. She feels ashamed and guilty that she might be struggling, and that she might not be looking after Don as she may have previously. But this is now a core belief, and that is because of the continual insistence by Alison that Ming doesn't look after Don, and in fact is abusive towards Don. So that's really ingrained in her now. And in fact, I would suggest, throughout this whole process, that there's a level of gaslighting going on with Alison as well. So Ming is continually trying to prove to both herself to SRV, quite unnecessarily, I must say, and to Alison that she can look after Don, and just as she's done for the last 30 years, and just as well as she's done for the last 30 years. There's been accusations that Don is not fed, that he's malnourished, that Ming doesn't cook, and yet we've been in the home and we're quite familiar with Don, and that nothing could be further from the truth. This is further reinforced, though, by systems who defer to Alison rather than Ming due to language barriers. So this whole tangled web is further impacted by people deferring to Alison. The psychological abuse continues when Ming is hospitalised with heart issues and leaves Don at home to go to hospital. She calls an ambulance and Don's left home. So she gets to the hospital and she asks the hospital staff to contact Alison, which they did, because she was concerned about Don being at home by himself. So Alison takes Don, puts him into an aged care facility and refuses to tell Ming where he is. She says, I'm the one with the power. I'm the one who gets to make that decision. So a few days later, Ming is discharged and is further stressed after having stents put in. She's further stressed because she doesn't have her husband at home. And even though she is his carer and she probably needs rest, she wants him by her side. And she's not able to speak with him on the phone because she doesn't know where he is. And so after 2 weeks, Alison all of a sudden reappears with Don and returns him to the home at the relief of Ming. So more recently, as Leonie has said, Ming has been ill and run down with tasks of looking after Don, and she asked Alison if she could organise respite. And Alison declined this, she said, "There's nothing wrong with you. Why do you need my dad to go into respite?" And when Ming says, "I'm really unwell," she said, "That's fine. I will come and look after Don in the home. I'll bring my family and you can move out and you can move to a motel or something where you can just have some rest and I'll look after the house," which, as we know, is totally inappropriate. So Ming rings the advocate and asks for help in tears. She was absolutely beside herself. So she asks the advocate, and the advocate, myself, calls Alison, and we ask for the details of the aged care facility that Don had been admitted to last year. These details were declined. Alison told the advocate that the advocate didn't understand Don's needs and that he couldn't go into just any aged care facility. It needed to be one with a memory support unit as opposed to a dementia unit, and with someone who speaks the same language as Don. So the advocate researched appropriate facilities and spoke with Dementia Australia. I did quite a bit of research into this, so I was armed with the information that I needed, and I provided a list of facilities with vacancies, immediate vacancies, or within the next few days, to Alison. Alison then took a further 3 weeks. She wanted to go and view each facility, but she said it was too much of an onerous task because she had her own family to look after, although her kids are teenagers and are able to look after themselves. So she took 3 weeks and then decided on a facility and organised that movement. So it took nearly 4 weeks by the time Don had moved into the facility. This put further pressure on on Don's health and put it into a precarious position because Ming was further in a weakened state, while if Don had have left earlier and been put into respite, she could have recovered quite quickly, but those illnesses were extended out because of her need to look after Don. She expressed to the advocate that this abuse is causing her so much distress, she just could not go on and she felt like ending her life. And so I assessed her and provided appropriate referrals. So during these times, and every time that there's been hospitalisations with either Don or Ming, SRV has remained at the centre of care teams which included hospital staff and the home care package case manager.
The way I see it, it's this abuse of Alison's abuse of her powers while acting as attorney or guardian to perpetrate emotional and psychological abuse is the reason for the need to appoint an independent guardian and administrator in the circumstances. The Office of Public Advocate's view on the appointment of an independent administrator and guardian is that it is a last resort where there is no less restrictive alternative. It is considered far better for a family member to make decisions than a stranger to make decisions on behalf of a represented person. The exception to this is where there's long-standing family conflict, which is the case here. Alison clearly harbours animosity towards Ming, and this affects her ability to make the decisions. Basically, her actions show that the parties cannot reasonably work out matters between themselves. Another consideration that VCAT and OPA will have is what is the will and preference of the represented person. In this case, it is virtually impossible for Don to communicate what his will and preference is. Don has advanced dementia and limited ability to participate meaningfully in the hearings. Furthermore, the interested parties have very different views as to what would be Don's will and preference. What I do have to say about this is that VCAT and OPA have a much better chance of establishing Don's will and preference when all interested parties are given a voice. Prior to Seniors' Rights Victoria's involvement, Ming's voice was essentially excluded. Alison's voice tends to be more prominent in most settings because she is the only English speaker. Unfortunately, people default to using Alison as the de facto interpreter for both Don and Ming. Seniors' Rights Victoria has been able to overcome this barrier using interpreters.
So, as I mentioned previously, during both the VCAT and the Magistrates Court's proceedings, Ming has been afforded various levels of engagement. Both VCAT and the Magistrates Court have provided minimal assistance with interpreters until the final VCAT hearing, when an interpreter was provided for the entire hearing, and the member would stop to ensure that Ming was understanding of the process and what was being said. She was also asked for her input, which had not happened previously at any of the other hearings. The ability to contribute to the hearing, be aware of what was being said about her by Alison, and the ability to respond to accusations allowed Ming to be heard, which had a profound impact on her agency and on her mental health. And while it's been difficult for Ming throughout this period, with barriers from both her stepdaughter and the systemic barriers that we've been discussing today, the interventions by SRV have proven to keep her legally, physically, and psychologically safe, relatively psychologically safe. SRV has built a trusting relationship with Ming, allowing her to feel empowered to ask questions and defer police and hospital staff to SRV when she has been unable to express herself or there's been confusion over who has been able to make decisions for Don. And this has made a huge difference to her agency for both herself and for Don, her mental well-being and her legal outcomes. And that is the conclusion of our case study. Thank you very much.
Thank you so much, Jacinta and Leonie. That was very, very detailed case study, and I know that in preparation for this session we did discuss presenting multiple case studies, but the matters that we deal with are extremely complex, and this one does really illustrate how complex the needs of the clients and the needs of the other parties are, and the amount of involvement that SRV has both in the legal and non-legal spaces supporting these clients. So I think that was a really, really thorough example of the kind of work that Seniors Rights Victoria does. So if anyone has any questions, I encourage you to put them in the chat or put them in the Q&A box. We do have one general question, and I think the other panelists here can read what it is. Otherwise, I can read it out for anyone who doesn't have access to that chat box. It's a general question about whether a scenario would constitute elder abuse, and this is really a type of situation that we do get inquiries about all the time. So I'll read it out, and then maybe we will throw to Jacinta and Leonie to how they would respond to this inquiry. So it's a 36-year-old who has not spoken to her father for the last 10 years, apparently due to the breakdown of her parents' marriage. The daughter is living in the marital home with her husband. No rent is paid to the father, and she is not allowed the father to see his newest grandchild. And the question from Char is this elder abuse? So I might first throw to Leonie to start with. If this client was in an advice appointment with Seniors Rights Victoria, what would your response to this inquiry be?
Potentially, yes. It depends. So a lawyer's answer is always it depends. So, but certainly withholding access to grandchildren can be a form of elder abuse. So the daughter is living in the marital home, as in the family home, I'm assuming. So
I'm assuming with the reference to rent that it means it is the parents' marital home.
Yes. So, and that's something that we do see quite often, is where, and it's a bit of a red flag for potential elder abuse, is where you have adult children moving back home. So yes, that definitely is a potential for there to be elder abuse. So is the, and I have lots of questions. Is the older person living in the same home? Are they prevented from returning home? Because that certainly is elder abuse. So, but yes, this is a very common factual scenario that we see regularly. So, Jacinta, would you have anything to add there?
Yeah, look, I mean, if I isolate my answer to is this elder abuse, I would say yes. Not allowing a grandchild who is, from the way I read it, living in the home, and there's also, no rent. What's the payoff? Is that like an assets for care? And I'm not stepping into that legal minefield. I will just leave it there, which Leonie can discuss. But there are things that as advocates we can help with. So we can first talk to the dad if he's the person ringing the helpline, and we can just he can be heard. And I think this is the first step where everyone deserves just to be listened to. Particularly when you're older, a lot of people don't stop and say, we'll give you this time. It doesn't matter if it's 5 minutes, doesn't matter if it's 20 minutes or more. We'll give you this time to listen to you. And then we can move into, okay, so do you need a referral? Do you need to book in for an advice? So this is at our helpline stage. Do we need to book you in for an advice? And, we always say at Seniors Rights, we'll err on the side of caution, because the advice, as Avital said earlier, is advice. They can sit on it for 3 months. They can do something about it straight away if there is something to be done, or they can just disregard it completely. And then, you know, there's that decision to be made whether it becomes a case or not, depending on the rest of those circumstances that are teased out in that advice. So there are referrals certainly to be made at the helpline and advice stage, but it may carry on to a case as well.
Thank you both. I might also add that in the scenario, I know you've described it very, very briefly, but in the scenario here, there are two things that stand out for us quite obviously. The one is staying in the home of the older person and not paying rent is potentially a flag for financial abuse, but we would need more information to determine that. And similarly, the withholding of grandchildren can be a form of emotional or psychological abuse. But again, we would need to ask more questions to determine whether that's actually occurring. But this is definitely a scenario that we would recommend you refer into our service at the very least as a secondary consult, so that our staff could have that conversation with you and maybe tease out a few more of those details. So I don't have any more questions in the chat or in the Q&A, but just generally going back to the case study, I think it would be important for participants to get an idea of how to establish trust with older clients who might feel ashamed or fearful or reluctant to disclose the details of the extent of the abuse. So maybe Jacinta, you can answer that for us.
Yeah, sure. Thanks, Avital. So firstly, as Avital has described our service, a client or for a secondary consult, so a client would come into our helpline and we would be speaking with the client and as we're talking, all the people on the helpline are counsellors, social workers, nurses. We're all qualified. We're all from that field. It's not a call centre. So we have the ability, we all have the knowledge and the skills to build that therapeutic relationship right from the beginning. So we build that relationship, we ask the right questions, and we determine whether someone might need an advice. Otherwise, we will provide referrals to appropriate services. So it might be that it's something that is more to do with an aged care facility, and then we'll refer out to another service. But we build that therapeutic relationship, and we do that really gently. Like Avital said earlier, it's about asking those questions, but not being directive, not accusing, or not sounding like, oh, your child is bad. And as you heard me talking about in that case study, there's a lot of guilt and shame around elder abuse, which it's sort of different to the intimate partner violence because you've chosen a partner and now you've separated, where as with elder abuse, because it's generally an adult child, you have this shame and guilt. What did I do wrong in building, in bringing that person up? Or I've got 3 kids and that's just one that is the difficult child or the black sheep. And so, we talk to them about that, we ask those questions really gently and we normalize the situation. You're not the only person in this situation. This does happen. It is okay to talk about it and we are here to support you. And then we do this, that follows into the advice. So we do this exactly the same thing in the advice. So the lawyer and the advocate sit in the advice with the older person, and the advocates essentially, listen to what the lawyer's saying, and sometimes we sort of translate some of that legal language, but we're there always supporting the older person, and that's how we build that trust.
Great, thank you. That was very comprehensive, and I have another question that sort of follows on from that a little bit. You've mentioned the lawyer and the advocate sitting in the appointment together, and how valuable is integrated practice to adequately supporting clients like those that are in Min's position?
It is completely invaluable. It's such an amazing it's an amazing process, and to work with any integrated model is really essential, I think, to have an understanding of each other's practice and to build trust, so that for the lawyer and the advocate to have that relationship where we bounce off each other through the advice and we have trust of one another and know that, we will be able to manage this client together. And that's what we have here at Seniors Rights Victoria. We previously, as I mentioned in the case study, there was a trial that went on for 5 years that was the integrated model of care, which was based in hospitals around Victoria, and that was defunded, which has then left a large hole. So, we try and the best we can, we're looking for those legal avenues, but then that has increased somewhat the workload of the advocates. But it is about, not the client not getting legal advice and then the lawyer referring out because they think that the client might need advocacy. It is all of us sitting together and identifying that along the way. And it might be that, an advocate might miss something and the lawyer might say later, we have discussions and they'll say, oh, what about this, or I might say, I'm not a lawyer, but what about that? And we have those discussions, and it's proven really successful.
Yeah, thank you. Thanks, Jacinta. I'm conscious of the time, and I do have a couple of questions for Leonie as well. So the first one is related to older people in cases involving attempts to manipulate guardianship or financial arrangements. What are the common legal challenges faced when you're representing those clients?
Well, particularly in the case study that we spoke about earlier, is ascertaining the represented person's will and preference when there's questionable capacity. That can be extremely difficult, particularly when there's complex family dynamics and everyone having their own different views on what that will and preference would be, but not being able to just ask the older person, well, what is your will and preference? So, and capacity can be really difficult. So, Don, in this scenario, it would be, it's difficult because he is a very vulnerable person, and so because he lacks capacity, Seniors Rights Victoria can't represent him, but also there's very limited referral pathways for him because there aren't many services that will act in these kind of matters. So so it's not just that there's no other community legal service that would act for a person that lacked capacity, but many other legal services won't act for family members in these matters for whatever reason, and that makes it really difficult to be able to find support for the older person. It leaves a bit of a gap.
Of course. And you mentioned some of the barriers that Min in particular was facing in her matter, and how did you overcome those barriers?
So the barriers in terms of her being able to access the legal system. So, through the use of interpreters, I think that's really important. Ensuring that people speak with her directly through the use of independent interpreters, empowering her with those softer skills and one of had a proud moment in this matter is where Ming was in a doctor's appointment with Don, and she actually told the doctor that she didn't want him to be speaking with or diverting to Alison, and wanted an independent interpreter in those doctor's appointments. So, and I guess empowering her to have a voice, not just in the legal proceedings, but just in general. And for her to, because I think that when she came to us, that was the biggest issue, is that she felt she didn't have a voice. And part of the abuse that was being perpetrated against her was Alison saying, well, you won't be believed because you don't speak English. So it's less about the legal issues and more about facilitating her participation in the hearings and with the legal process.
Yep, perfect. Thank you so much, Leonie, and thank you, Jacinta. I might just race through the final slide. I see there's a question in the chat, and I will respond to it. So if you would like more detailed information about different types of elder abuse and the options available for older people experiencing abuse, our website has a really vast library of resources. They've been translated into 25 different languages to make them more accessible. There are videos and printable information sheets, brochures and booklets, and you can also contact us if you want any hard copies of anything sent out. We also run a more comprehensive interactive workshop for professionals around how to recognise the signs and respond to elder abuse. And we run some prevention education programs as well around planning ahead, so planning for your future, things like decision-making, powers of attorney, medical treatment decision-making and advanced care directives. And more information about those programs can be found on our website as well. The website address is at the bottom of each of these slides. And for those of you who have patients or clients who are experiencing or at risk of experiencing elder abuse, you can contact our helpline for a secondary consult. The turnaround time for helpline calls at the moment is within 48 hours. We do respond to most calls within 24 hours though. And the helpline number is just listed in the bottom of the slides as well. As well as that, we will shortly be implementing an online referral system for professionals to fast track those referrals as well into our service, where we can get a little bit more information that we need, so we don't need to have as many back and forth conversations with the referring professionals. Or you can direct your patients to contact the helpline directly, and they'll be able to speak with someone within 24 hours generally. Great, right on 11 o'clock. So if there are no more questions, which it doesn't look like there are, thank you very much for attending our presentation today. I hope it was informative. And as I mentioned, you can access a wealth of resources around elder abuse and the programs that we support through our website, which is seniorsrights.org.au. And I hope everyone enjoys the rest of their day. Thank you as well to all the other panellists today.